Have you ever felt like there are topics about your body, your intimacy, or your well-being that, once you pass 60, become invisible or, worse, burdened with shame? If you're over 60 and the word masturbation brings a knot to your stomach, a blush to your cheeks, or a feeling that it's something that simply isn't talked about, then I urge you to stay. This video is intended to break those silences and shed light on a natural part of life that is often shrouded in myths and taboos. I completely understand if, even when listening to me, discomfort or embarrassment persists. Believe me, you are not alone in that feeling. We have been programmed for decades, perhaps a lifetime, to view sexuality in a very limited, very specific way. From childhood, many of you were taught that sex was primarily for procreation, or that it was a dirty topic not to be discussed. And masturbation, in particular, was stigmatized as something sinful, childish, or at best, an unspeakable secret. But what happens when those beliefs carry over into old age? They become an even bigger barrier. Suddenly, society seems to dictate that your sexuality, your desire, and even your ability to feel pleasure should disappear, or at least become invisible. It's assumed that if you're an older man, masturbation is a sign of loneliness, an inability to find a partner, or worse, that you're doing something inappropriate for your age. These are deeply flawed and frankly very damaging ideas. I want to be emphatic about this. Masturbation is a natural and healthy expression of human sexuality at any stage of life. It's as normal at 70 or 80 as it was at 17. It's not a sign that something is wrong, that I'm less of a man, or that I'm looking to replace something. On the contrary, it's a legitimate act of self-care and self-discovery. Think of this as a way to maintain a vital connection with your own body, to remember that pleasure is your right, regardless of your age, marital status, or physical condition. Often, social pressures and cultural myths make us feel that, as we age, we must give up fundamental aspects of who we are. But sexuality and pleasure don't have an expiration date. In fact, masturbation can offer a number of important benefits. For older men, we're not just talking about the physical release of tension, but also a positive impact on their emotional and mental well-being. It's a way to reduce stress, improve mood thanks to the release of endorphins, and maintain erectile function and pelvic health. Beyond the physical, it's an affirmation of their autonomy, their right to feel and enjoy. Don't let silence or old taboos rob you of this opportunity for well-being and connection with yourself. It's time to shed those layers of shame and recognize that self-stimulation is a valid and, for many, a very valuable part of a fulfilling life, no matter how many candles you've blown out on your birthday cake. Now, let's delve into one of the most persistent myths, and thankfully, one of the most easily debunked by modern science: the belief that frequent masturbation or ejaculation is somehow harmful to health, especially the prostate. For a long time, it was whispered that this act could exhaust the body, weaken virility, or even cause disease. But the reality, backed by decades of research, is that regular ejaculation can, in fact, be a beneficial component for prostate health. Think of the prostate as a vital, walnut-sized gland located just below the bladder. Its main function is to produce seminal fluid, which nourishes and transports sperm. Like any other system in our body, it requires regular functioning and maintenance. To be in optimal condition, this is where ejaculation comes into play. Imagine the prostate as a small plumbing system. If these pipes aren't used or cleaned regularly, fluids can stagnate, and substances that shouldn't accumulate could do so. Ejaculation acts as a kind of natural flush. When you ejaculate, the prostate releases seminal fluid, eliminating not only old sperm but also any buildup of cells, toxins, or potentially irritating agents that may have formed in the prostatic ducts. This renewal of fluids is considered a mechanism that can help reduce inflammation and keep the gland in a healthier state. Research in this field has been quite revealing. A much-cited study, conducted by Harvard University and published in the journal European Urology, followed nearly 32,000 men for 18 years. what did they find? That men who ejaculated more frequently, specifically 21 or more times per month, had a significantly lower risk of developing prostate cancer compared to those who ejaculated between 4 and 7 times per month. This finding was not a one-off. Other studies have reached similar conclusions, strengthening the evidence for a positive correlation. It's important to understand that this doesn't mean ejaculation is a cure or a guarantee against prostate cancer. Health is multifactorial, but it does suggest that it's a protective factor that contributes to the gland's overall well-being. The theory behind this is that regular fluid expulsion helps prevent the buildup of carcinogenic substances, reduces chronic inflammation, a known precursor to disease, and facilitates healthy cell renewal. This is a completely opposite perspective to the old fears of wear and tear or damage. So, when we talk about masturbation, we're not just discussing pleasure or the release of tension, but also an act that, from a purely physiological and scientific perspective, can play a role in actively preventing and maintaining a healthy prostate. It's a powerful rebuttal to those myths that have so long sown guilt and shame. Science invites us to view male sexuality, and specifically ejaculation, not as something to be repressed out of fear, but as a natural and, in many ways, beneficial bodily function that supports our long-term health. Leaving those taboos behind means not only freeing our minds, but also opening the door to a more holistic and empowered approach to our own bodies. It means understanding that taking care of ourselves, in all aspects, includes listening to and attending to the needs of our sexuality without prejudice or old superstitions. Prostate health, for example, is not just a matter of medical exams, but also of lifestyle habits. And ejaculatory frequency is one of those habits that research has put in a new and positive light. It allows us to understand that what was once considered a shameful act can now be seen as a valid strategy for our well-being. This scientific reevaluation not only frees us from guilt, but also opens the door to a deeper understanding of the complex interconnection between our physical and mental health. If regular ejaculation can be a prostate protector, what other benefits can we discover by shedding prejudices and embracing a holistic view of our sexuality? One of the most immediately tangible and universally experienced benefits is the profound relief from stress and anxiety. We live in a society that places high demands on us, pushing us to always be active, connected, and productive. Work worries, personal pressures, social demands, everything accumulates, creating a burden that, if left unmanaged, can take its toll on our mental and physical health. Masturbation, in this context, emerges as a surprisingly effective and accessible self-care strategy. When we indulge in this act, our body responds with a symphony of neurochemicals. Endorphins are released, those powerful, natural painkillers and mood lifters that fill us with a sense of euphoria and well-being. It's the same reason we feel good after intense exercise. At the same time, the release of oxytocin, known as the cuddle hormone or bonding hormone, fosters a deep sense of calm and relaxation, and surprisingly, can generate feelings of connection, even in a solitary act. And we can't forget dopamine, which generates a feeling of pleasure and reward, essential for well-being. But perhaps most crucial for stress management is that masturbation contributes to the reduction of cortisol levels, the main stress hormone. Chronically elevated cortisol is associated with a multitude of health problems, from weight gain to immune system suppression and cognitive decline. By promoting a decrease in cortisol, we are literally giving our body and mind a much-needed break. Think of that executive or student who, after a tiring day or before an important event that makes them nervous, finds this intimate space a sanctuary to vent, to release the tension accumulated in their shoulders, their jaw, their mind. It's a reset, a moment to let go, allowing the nervous system to regulate itself and find a state of balance. It's not just a momentary pleasure, but a tool for managing the emotional complexities of modern life. Like meditation or exercise, It's a form of active mindfulness, focusing on the sensations of one's own body, being fully present in the now, far from external worries. This practice of self-care is a fundamental pillar for maintaining good mental health over the long term. Furthermore, this relaxation and stress reduction effect has a direct impact on sleep quality. Many people struggle with insomnia or fragmented sleep due to overactive minds, filled with thoughts and worries. Masturbation, by inducing a state of calm and well-being, can be an excellent prelude to deep, restful sleep, which is vital for the body's physical and mental recovery. A rested body is a more resilient body, better able to face daily challenges with patience and clarity. It's a virtuous cycle: less stress, better sleep, greater ability to manage stress. And this isn't the only aspect of our mental well-being that is enhanced. In fact, the connection between body and mind is so profound that this emotional well-being we find in self-exploration can manifest itself in many ways. A less stressed mind, as we've already mentioned, is better able to focus, make decisions more clearly, and interact with the world in a more positive and constructive way. It's a natural mood enhancer, helping us stay grounded and optimistic in the face of life's ups and downs. And let's not underestimate the power of feeling good about ourselves, of accepting our bodies and our needs in a healthy, guilt-free way. This self-acceptance is a key element for strong self-esteem and a fulfilling life. However, this is where we must pause for an important, crucial moment. While masturbation is a powerful and personal tool for stress management, improved sleep, and overall mental well-being, and I celebrate each of these benefits with you, it's critical to understand that it is not and cannot be a substitute for professional, preventative medical care. Think of it this way: caring for our minds and emotions is like watering a plant so it grows healthy and strong. It's essential. But that plant, from time to time, needs an expert to examine its roots and its soil to detect in time any pests or nutritional deficiencies that we can't see with the naked eye. Our body is a complex system, and even if we feel good on the outside and our mind is calm, there are internal processes that can only be monitored and evaluated by healthcare professionals. True wisdom lies in prevention. We can feel full of vitality without obvious pain or discomfort, and yet our body could be silently harboring a condition that, if not detected in time, could become a serious problem. Consider, for example, men's health and the importance of specific checkups like the PSA test for the early detection of prostate problems. The prostate gland, that small gland that plays a crucial role in the male reproductive system, can develop conditions without raising any warning signs in its early stages. A man could lead an active sex life, fully enjoy the benefits of masturbation, and feel completely healthy, while internally a disorder could be developing. Masturbation cannot diagnose abnormal cell growth in the prostate, nor measure the levels of prostate-specific antigen, PSA, in the blood. These are biochemical and physical indicators that only a laboratory test and a medical exam can reveal. Imagine not going to the dentist because you brush your teeth every day. Brushing is vital, but it doesn't replace detecting early cavities or having your gums checked by a professional. Similarly, although self-examination is a healthy part of life, it does not have the ability to observe or diagnose internal conditions. Medical science has made great strides in providing us with tools that allow us to anticipate diseases, detect them when they are most treatable, and, in many cases, cure them. Refusing to use these tools deprives us of an invaluable opportunity to protect our long-term health. Regular checkups are not a sign of weakness, but of intelligence and personal responsibility. They are an investment in our future, in our peace of mind, and in the ability to continue enjoying all aspects of life, including the emotional well-being we cultivate through healthy practices like masturbation, but which must always be complemented by expert care. Early detection is, in many cases, the key to a favorable prognosis and a full recovery. That is why, at a certain age, it is strongly recommended that men men are strongly recommended to undergo specific preventive checkups, such as prostate exams or colonoscopies. These aren't just medical procedures, they're windows into our bodies that allow us to see what our eyes can't and feel what our hands can't. Consider the case of Juan, an active and seemingly healthy man who, like many, believed that feeling good meant he didn't need to go to the doctor. Juan was diligent about his exercise, his diet, and yes, also his personal wellness practices. However, one day, a friend insisted he go for his annual checkup since they had both turned 50. Juan, somewhat reluctantly, agreed. During the routine exam, the doctor detected a slight elevation in his PSA, and after further testing, they found a prostate tumor at a very early stage. Thanks to that early detection, Juan was able to receive timely treatment, and today leads a full life without major complications. His story is a testament to how active prevention can change a destiny. Denial is a very powerful human mechanism. We often prefer not to think about the possibility of getting sick, or we even convince ourselves that it won't be anything serious if we experience an unusual symptom. Perhaps we feel persistent pain, notice a change in our bowel or urinary habits, or see a different spot on our skin. Instead of seeking a professional opinion, some turn to the internet, self-diagnosing themselves with often incomplete or erroneous information, or worse yet, completely ignoring the warning signs. This attitude is a latent risk. Not only do we lose precious time to act, but the problem, if it exists, can silently worsen. Even in the context of our wellness practices, such as masturbation, if we use it as a distraction or an escape to avoid facing a bigger health concern, we're falling into a trap. If we notice ourselves resorting to these practices compulsively, not for pleasure or relaxation, but to quiet an underlying anxiety or evade a physical symptom that worries us, it's a warning sign we shouldn't ignore. The body speaks, and sometimes it does so in whispers that we may misinterpret or simply not hear. Dr. Ana Maria Polo once said, "Ignoring symptoms is like painting a wall without fixing the crack. The problem is still there, just hidden." And so it is. It's crucial to understand that the responsibility for our health is shared. Partly falls on us by adopting healthy lifestyle habits, and partly, very importantly, on the medical professionals who offer us the tools to take care of ourselves. There's no shame in seeking help or undergoing tests. On the contrary, it's an act of courage and self-love. True strength lies in being proactive and responsible. Fear of the unknown or the discomfort of a brief procedure shouldn't be obstacles that prevent us from protecting the most valuable thing we have, our health and our lives. For example, that small change in a mole that we decide to observe instead of showing it to a dermatologist, or that tiredness that we attribute to stress when it could be an indication of something deeper. These are the warning signs we shouldn't ignore. In short, we've explored how our bodies speak to us through signals that we often try to ignore or mask with distractions. We've emphasized the courage to be proactive, the importance of never underestimating any symptom, and the wisdom of always seeking professional medical guidance as a fundamental act of self-love. I'd love to know, what was that signal from your body that, once listened to, led you to make a crucial decision for your well-being? If this message resonated with you, I wholeheartedly invite you to subscribe to our channel, activate the notification bell so you don't miss our future conversations about wellness, and of course to share this video with those you know would benefit from it. Thank you for joining me in this space of reflection and growth. Until next time, take care of yourselves, and always listen to your wonderful body